When it comes to hair, many of us, we take it for granted that we'll always have a full head of hair. Many men and women suffer hair loss, though, and it can be devastating for the sufferer's self-esteem and emotional well-being. Elisa visited Columbus Aesthetic and Plastic Surgery to find out about a promising new procedure for hair loss.
If you're experiencing hair loss, it can be devastating for your confidence. But there is a solution here at Columbus Aesthetic and Plastic Surgery. Award-winning plastic surgeon Dr. Tyler Angelos is joining us today to talk about Neograft Hair Restoration. Good morning.
Good morning.
So tell us, what is Neograft Hair Restoration?
So Neograft Hair Restoration is a hair transplant system that's FDA approved for men and women, where hair follicles from the back of your hair, the follicles that are thick, the follicles that aren't sensitive to the hormones that cause hair loss, those follicles are transplanted from the back of the head up to either the top of the head or the front of the head, areas that are experiencing hair loss or hair thinning.
Wow, who would be an ideal candidate for that procedure?
So ideal candidate is anyone, any male, any female that's experiencing either hair thinning or hair loss. One common misconception is this is for males only, and probably almost half of our patients are females who are just experiencing thinning hair. Another misconception is that this is, especially for the men, that you have to wait until you're completely bald or have a large bald spot before you try the Neograft. That's false. The Neograft works wonderfully for just a receding hairline, which is very, very common and prevalent.
And what is the procedure? Kind of take us through the process.
So the procedure is all done in one day. You'll plan to spend the whole day with us here in the office. You'll come in the morning, we'll get you nice and comfortable, and over the first 2 to 3 hours, actually take out all the hair follicles from the back of the hair that we'll be using as the donor follicles. We'll then let you stand up, walk around, get something to eat, and then you sit in an upright position, just watching a movie in the afternoon while those hair follicles are then implanted in the front of the head and the top of the head. There is no cutting, there's no scars, there's no surgery. There's essentially no downtime after this, and this is all your natural hair. It's not just done on the top of the head as well. It can also be used for men to fill in facial hair, the beard, the mustache area. It can be used to fill in eyebrows, and it can be used to fill in scars, especially scars that are on the scalp from past surgeries, some sort of an injury or accident, or even old hair transplant techniques that caused big scars.
That can be life-changing for someone to get that procedure done.
Absolutely.
And tell us, what's the difference between Neograft hair restoration and other methods?
That's a good question. So the old technique involved actually cutting into the back of the scalp and leaving a big scar, and that part of the scalp was then used to use the follicles for the hair transplant. We no longer have to do that. We're able to take individual hair follicles using the Neograft, using this handpiece right here, which is pneumatically controlled. The hair follicles are extracted through here, and using that technique of the Neograft, they are not damaged, and then we're able to implant those hair follicles into the areas that are going to be treated.
And how soon can someone see results? And then how long do those results last?
That's a good question as well. So the initial hair follicles go in, and there's initially short hairs that are there. The hairs that are there undergo a natural process of shedding about 3 weeks after the procedure is done. Following that shedding process, the new hairs start to grow in, and they start to become visible about the 3 to 4 month time after the procedure. Once the hair starts to grow in, it's your own natural hair. You can treat it, style it, cut it, treat it just like your normal hair.
Really?
Yeah.
That is amazing. So you were saying that if someone wants to have this procedure done, they shouldn't wait until they're completely bald. When should they initially call you?
So we always say earlier is better, because we can anticipate where the hair loss is going to happen, and we can plan for future hair loss with this procedure. We can start to fill in those areas that already have hair loss or that are already thinning, and then we can plan where the future hair loss is going to occur.
Wow, it really sounds like that's something that someone should do if they're experiencing that hair loss.
Yeah.
Thank you so much, Doctor, for talking with
welcome.
us today.
Thank you.
And be sure to give Columbus Aesthetic and Plastic Surgery a call if you'd like to find out more about the Neograft Hair Restoration.